Today, we are diving into a seriously gripping medical mystery. We're not just talking about some abstract theory here either. We're going to explore a fully documented case study where the absolute extremes of human consciousness collide right head-on with modern intensive care. We're looking at a fascinating, peer-reviewed report about a guy who crossed the threshold between life and death and, well, what his brain brought back with him from the other side. So let's jump right in.
Just imagine waking up in a hospital bed, you're surrounded by all these beeping monitors, and this is the memory playing on a continuous loop in your mind. I became stuck in a time loop, experiencing the entire CPR attempt over, and a voice told me there was no heaven or hell. That exact quote comes from a 74-year-old patient who had just survived cardiac arrest. You see, he didn't just feel like he passed out, he felt like he literally stepped outside of time itself. He was forced to watch medical staff try to save his life over and over again, all while this mysterious voice delivered a really chilling message. This was his reality. And it hooks us immediately into one of the most profound mysteries in all of medicine: what actually happens in the human brain when the heart just stops beating?
Section 1. A terrifying awakening.
You know, pop culture kind of conditions us to think near-death experiences, or NDEs, are peaceful, right? It's always about moving toward a warm light or feeling this overwhelming sense of tranquility. But today's case study proves that the brain's reaction to clinical death isn't always comforting. Sometimes it can be purely 100% terrifying, leaving scars that the body might heal from, but the mind? The mind really struggles to process it. Let's walk through this dizzying medical cascade the patient went through. Day 1, he's admitted for heart failure. By day 10, doctors find a mass and he undergoes surgery for colon cancer. Day 16, a blood clot causes a pulmonary embolism. And then, the critical moment hits on day 17. He goes into cardiac arrest. His heart completely stops. For 5 agonizing minutes, medical staff perform CPR before they finally get a return of spontaneous circulation. He's finally taken off the ventilator on day 19. I really want to emphasize the timeline because it shows you the immense, compounding physical trauma this man's body endured over nearly 3 weeks. And that's all before his brain even had a chance to wake up and process the trauma of the NDE itself.
So this brings us to day 20 in the ICU and the incredibly grim reality of the aftermath. The patient was off the ventilator, his heart was beating on its own, but he was actively fighting off sleep. He was absolutely terrified that if he closed his eyes, he was going to die again. He officially met the DSM-VTR criteria for acute stress disorder and acute delirium. The psychiatry team had to be called in because this poor guy was practically torturing himself trying to stay awake, just out of sheer terror from what he saw during those 5 minutes his heart was stopped.
Section 2. The out-of-body experience.
To figure out why he was so traumatized, the psych team had to ask him exactly what he remembered. And he told them, "I saw myself hovering over my body, looking down from close to the ceiling while the nurse brought the crash cart." He noted that his visual perception was incredibly sharp. But it wasn't just the doctors and nurses he saw. He reported seeing these eerie, completely unrecognized figures standing in the air next to him. They didn't speak, but he felt this overwhelming sense that they were from, quote, the other side, and that they were literally just waiting there to take him away.
Now, what's really interesting about this slide is how it pivots us from what sounds like a spooky ghost story right back to grounded, clinical reality. It's so easy to hear about floating near ceilings and eerie figures and think, okay, this is science fiction. But it's not. This case was carefully, thoroughly documented in the peer-reviewed medical journal Psychiatry Research Case Reports. This is the medical community actively trying to understand the very real psychological fallout of these extreme physiological events.
Section 3. The science of NDEs. Zooming out from our patient's bedside for a second, what does the broader scientific data actually say about near-death experiences? Like, is this an isolated incident, or is there a pattern here? Well, I want you to let this number sink in. 39.3%. According to the 2023 AWARE-2 study led by Dr. Samparnia, nearly 40% of cardiac arrest survivors experience some form of an NDE. Nearly 40%. That is almost 4 out of every 10 people who are brought back to life. It's honestly mind-blowing when you realize just how common this phenomenon is in our modern hospitals.
So how exactly does science explain this? Well, there are some wildly different hypotheses out there right now. Some researchers think it's a neurophysiologic cascade, basically a massive flood of dopamine and endorphins meant to be an evolutionary calming mechanism during intense trauma. Others theorize it's an explosive network synchronization, basically the dying brain's network short-circuiting into this highly connected skeleton framework before completely failing. We've also got theories pointing to cerebral hypoxia, so lack of oxygen, mixed with inflammatory cytokine release. Or hey, maybe it's a massive spike in naturally occurring hallucinogenic neurotransmitters. There's even a theory that it's just an intense intrusion of REM sleep into waking consciousness. The point is, science is actively hunting for the biological mechanism here.
And this builds on a really specific, super intriguing finding from a 2023 study by Yuxu and colleagues. They found that a surge of gamma oscillations, which are the brainwaves associated with highly focused consciousness and memory retrieval and functional connectivity, actually occurs in the dying human brain. But here is the kicker. It happens specifically in the first 5 minutes after cardiac arrest. Notice the timing there. That is the exact literal 5-minute window our patient was undergoing CPR. While his heart was completely stopped, his brain might have been experiencing this massive electrical surge, making his subjective experience feel incredibly hyper-real.
Section 4. Delirium versus reality. So back in the ICU, the psychiatry team is sitting there with a deeply terrified patient. They had to figure out a crucial puzzle. Was he just delirious and hallucinating from all the medications and infections, or was he experiencing the psychological aftershocks of a true NDE? Getting this right is absolutely crucial for treatment. Delirium is usually confusing. Actually, scratch that, it's more like highly disjointed memories, and the hallucinations mostly feature living people from the patient's everyday life. An NDE is a totally different beast. The AWARE-2 trial established that NDEs are subjectively experienced as hyperreal. The memories are remarkably vivid, and they are highly stable over time. They don't just fade away like a dream. Plus, they often feature deceased individuals or supernatural beings. Our patient's memory of the crash cart and the hovering figures? Flawlessly detailed, logically sequential. That points directly to an NDE, not just standard ICU delirium.
And here is a truly heartbreaking aspect of this whole case. The patient actively hid this experience from the ICU staff at first. He didn't tell a single soul about the time loop or the voices until the psychiatric team asked him directly. And you know why? Because patients rarely volunteer their NDEs. They are terrified of being ridiculed, dismissed as crazy, or officially labeled as mentally ill. This poor guy was sitting in his hospital bed, totally isolated in his own terror, fighting off sleep entirely alone.
Section 5. The power of validation. Okay, this is where the story takes a really encouraging turn. We're going to look at the incredibly simple, non-pharmacological cure that the psychiatry team deployed to save him from his acute stress disorder. The treatment wasn't some heavy, intense antipsychotic medication. Nope. It was literally just 5 milligrams of melatonin to help him sleep, coupled with psychological validation. The team just sat down with him, explained what a near-death experience was, and told him, hey, this is a known, completely normal phenomenon among cardiac arrest survivors. He wasn't crazy. His brain had just gone through a known extreme event, and by the very next day, his fear of sleep, his flashbacks, his cognitive deficits, completely gone. Just knowing he wasn't alone basically cured his extreme anxiety. This gives us some incredibly clear takeaways for medical professionals. If we want to prevent severe PTSD in cardiac arrest survivors, we have to adopt a specific clinical approach. Step 1. You have to ask the patient directly. They just won't tell you otherwise. Step 2. Validate their feelings. Step 3. Normalize the phenomenon using the exact data we just covered. And Step 4. Do not pathologize the visions as a mental illness. Medical teams can even use screening tools like the Impact of Event Scale Revised, or IESR, to check for acute stress. Creating a safe space for disclosure is absolutely vital for a patient's long-term recovery. So we've seen the terror, we've seen the science, and we've seen the cure. But I want to leave you all with a really profound question. When we look at the data showing the heart completely stopping and blood flow ceasing, if the brain is fundamentally offline during those moments, how do human beings experience what they later describe as the most vivid, hyperreal memories of their entire lives? It really invites us all to ponder the ultimate mystery of human consciousness and what truly happens in those quiet, uncharted moments when we die. Thank you so much for exploring this case with me today, and as always, keep questioning everything.